right.
Let me just share the slides quickly.
So welcome everybody. Thank you for joining us for this Research Connect series. I'm Dr. Kelly Barak. I'm Professor of Medicine and Assistant Dean of the Physician Learning Program at the Cumming School of Medicine here in Calgary. I've previously served as the Director of the Southern Alberta Liver Transplant Clinic for nearly 20 years, and it's a great honor to be here to help facilitate today's webinar. So first, I'd like to acknowledge that the CDTRP is hosted by the University of Alberta, which is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous people, including the Cree, the Blackfoot, the Métis, the Nakota Sioux, the Iroquois, the Dene, the Ojibwe, the Saulteaux, and the Anishinaabe, as well as the Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. I would also like to acknowledge that this webinar is possible from the generous support of Takeda, AstraZeneca, and CIHR. And before we dive into the main content of the presentation, I'm going to pass it over to Erica for some quick updates.
Yeah, thank you very much, Dr. Barak. Today, I only have one announcement, and it's a save the date for our annual scientific meeting. This year's ASM will be held, it's almost 2 months, less than 2 months away, so it's very exciting. It'll be held in a hybrid format with the in-person component in Montreal, Quebec on December 5th and 7th. Registration is now open, and folks can register on our website. A link will be added shortly in the chat, and that's about it. Thank you.
Thanks, Erica. So just a few housekeeping notes before we get started. Today's session is being recorded and will be posted on the CDTRP website and YouTube channel. During the presentation, if you could keep your mics off. If you have any questions or comments, please raise your hand or type them in the comment section. I'll be monitoring the chat box, and we'll bring those up during the discussion period after the presentation. So I'm really pleased to introduce a couple of my colleagues who I've been working with for a little bit more than the past year now on developing the Transplant Wellness Program in Calgary. So I'll introduce them in the next slide. But can you go forward one slide, please, Maneka? I would also like to acknowledge that we are located in Calgary, and the University of Calgary is located in the heart of Southern Alberta, and both acknowledges and pays tribute to the traditional territories of the people of Treaty 7, which includes the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nation, and the Tsuut'ina First Nation and the Stoney Nakoda, which includes the Chiniki, the Bearspaw, and the Goodstoney First Nations, and that the city of Calgary is home to Métis Nation of Alberta Region 3. So I'm pleased to introduce the Transplant Wellness team. Unfortunately, our fearless leader and medical director, Dr. Stefan Mustafa, is unable to join us today. He's on call, a busy nephrologist at the Foothills Hospital, and but Stefan is here in spirit, and he established the prehabilitation clinic for kidney transplant patients, focusing on well-being and addressing frailty in that population several years ago, and really spearheaded this development to broaden that initiative and to bring it to other organ groups, including our patients in liver. And you're going to meet a couple of the other members of the team. Dr. Nicole Culos-Reed is a professor at the University of Calgary's Faculty of Kinesiology and Adjunct Professor in the Department of Oncology at the Cumming School of Medicine. She's the 2023 Killam Annual Professor, and her research really focuses on behavior change research, and she has done a lot of work in this area with cancer patients, and we're really excited that she's joined our team to help with our behavior change and coaching for our patients in the Transplant Wellness Program. And our other speakers, Maneka, who's our Senior Research Program Manager at the Transplant Wellness Program. She has a PhD in cell biology from the University of Alberta and a postdoctorate fellowship in pediatric oncology from the U of C, and has worked as a clinical researcher and research program manager with our pediatric nephrology group at the University of Calgary for several years before we were fortunate to recruit her to help us start this program, which you're going to hear about today. So I'm very excited. The rest of the team is on there, including our kinesiologist, Catherine, our patient partners who have been really instrumental in providing us feedback on the development of this program, and Dr. Deb Isaac, who is our head of our Southern Alberta Transplant Program. So with that brief introduction, I'm going to turn it over to my colleagues and friends to tell you all about our Transplant Wellness team.
Thank you, Kelly, for the generous introduction. So before we start, I want to tell you that we are very excited for this opportunity today to tell you about this new program that we've developed, which is the Transplant Wellness Program. And it has been developed to address the wellness needs of the transplant population in Southern Alberta. But before I tell you about the program, I want to tell you about frailty. So when we look at the transplant population, one of the key issues with this population is frailty. And it is defined as a clinical syndrome of decreased physiological reserve and diminished capacity to respond to health stressors. And it is common in the aging population and those who have chronic diseases. And when we look at the transplant population, the patients who become frail while waiting for surgery and those who have poor cardiovascular fitness have increased peri and post-transplant mortality, morbidity, and there's increased healthcare utilization. And there's been a number of studies done about frailty in the transplant population, which highlights this key issue of frailty. So that's why the Kidney Transplant Rehabilitation Clinic was developed in 2018. So rehabilitation is based on this concept that patients with higher functional capabilities will have better pre and post-surgical outcomes. And our rehabilitation program is an exercise-based therapy program, and it has been developed to improve an individual's fitness prior to surgery, and so that it results in better outcomes post-surgery. And we were able to enroll 115 patients into this program. And when assessed, about 44% of these patients were either pre-frail or frail, all these transplant patients that enrolled into the program, and about 55% patients were inactive. So what the clinic sought was to move these patients out of the pre-frail or frail category into the non-frail category, and to improve their outcomes post-surgery. So that's what this pilot study did, and this pilot study provided the foundation for future transplant wellness initiatives. Now, when we look at wellness in the transplant population, it is evident that there is a care gap and there is a need for wellness in the transplant population. So when we look at the present model of care at the Southern Alberta Transplant Program, also known as ULTRA, most importantly, it focuses on the acute and chronic medical issues. And we don't comprehensively address the wellness of patients and their families. So our goal, our team's goal, is to develop a program with a multidisciplinary team to optimize the patient's wellness pre and post transplantation. So our team is working towards wellness, or the concept of wellness. And the Global Wellness Institute defines wellness as the active pursuit of choices and lifestyles that lead to holistic health. And as you see here, wellness is multidimensional, and it is critical for enhancing overall quality of life. Now, there are many components to wellness, but our team has chosen to focus on exercise first. So when you look at the benefits of wellness, there are many. So it improves energy, it works towards preventing sarcopenia, and it reduces the risk of developing other conditions like metabolic diseases or cardiovascular issues. And it aids in managing a whole host of mental health conditions like stress, anxiety, and depression. And also it improves aerobic and functional capacity, and most importantly, it improves the overall health-related quality of life. So with that, I would like to hand over the presentation to Dr. Culos-Reed, who will tell you more about our Transplant Wellness Program.
Thanks, Maneka. So as Maneka indicated, we are at the starting point for the Transplant Wellness Program and focusing as the first piece of wellness, this component of exercise. The goal of this Transplant Wellness Program is really to build, though, that comprehensive support program for organ recipients to build their wellness both before and after transplant surgery. And the focus initially is on physical activity, movement, and exercise. This is being built as a hybrid effectiveness implementation study. So really looking at it as a clinical program and embedding the research to look at the effectiveness of this in a real world setting. So specifically, I'm going to give you just a little bit more background on what we're doing as our starting point with this focus on the exercise component. And we've built a multimodal exercise program, which is made up of different physical exercises led by a trained facilitator who is a clinical exercise physiologist. So if you're not as familiar with the exercise world, the clinical exercise physiologist, or also known as a kinesiologist in some provinces, has the scope of practice to assess and then prescribe individuals with unstable medical conditions with exercise. The multimodal component is actually a critical piece of this. So we're not focusing on just a walking program or just a stretching or strength training, but rather it's a combination based on what has been done in the research showing that all sorts of activities will lead to potential benefits across a variety of different outcomes. And by doing it multimodal, we can really see what works and what is needed for each individual. So it's really a personalized approach. However, we are also delivering it in a group setting. So you're going to see more on the details in a few slides here. But that's a critical component of what we're building. It's more than just exercise. By pulling this in to a group setting, we can harness the power really of group support and build that group cohesion so that these individuals coming into the Transplant Wellness Program have a community of support. And the exercise is simply the modality that we're really bringing them all together. And specifically, as you saw on that prior slide, it's an exercise and educate approach. So it's not simply a CEP giving them a tailored exercise prescription, but it's really the CEP delivering the group and some one-on-one sessions with that tailored, individualized approach to empower individuals to build wellness into their own journey. And our exercise and educate model is really built on that concept of empowerment, building autonomy or a sense of control for individuals who are often in this system and they're waiting for transplant. So it's a waiting game. They're not giving a lot of focus on wellness. And so by giving them this tangible piece that they can engage in, we can enhance their confidence and help them then develop those key behavior change skills that will allow them to build that habit of moving more or the habit of exercise. Again, using the group, we're also fostering that community of wellness. So building that support around them And those pieces, teaching them the individual skills, but really changing their transplant journey with this wellness component is more likely to result in sustainable behavior change than if you did just one or the other. Ultimately, our goal with the Transplant Wellness Program participants is to have individuals change how they see themselves, to change from someone who sees themselves as a sick individual or someone who cannot do things, to seeing themselves as someone who has the control, has the skills to be able to engage in something that is good for their body. So what specifically is offered? The exercise intervention is a 12-week program with 2 sessions per week that are anywhere from 30, 45 minutes to 60 minutes. And these are group-based classes. However, because we are really focusing on that tailored, individualized prescription approach, they will have a series of one-on-one sessions with the clinical exercise physiologist for at least the 2 weeks of their first 2 weeks of their intake. This ensures that we can help the individual get situated to doing the exercise, feeling comfortable, have done that initial assessment piece, and then as people come into the program, we can build the group nature so that they have that for the most of their exercise intervention. Most of the programs, but not necessarily all, will be delivered online. And this is really built from the work in the prehab kidney group, which has seen that many of them do prefer online, even post-pandemic. There's access issues that become easier, the comfort of doing it in their own home. And so really we will see, based on the needs of the individuals as they come in, if they need that direct supervision in person, or if they are safe and able to do it from home. Importantly, the Transplant Wellness Program is not just a 12-week intervention. It is the 12-week intervention and then building that community of support and additional resources to really help them cement their behavior change over time. Okay, we know an exercise habit and that behavior change doesn't just happen in 12 weeks. It doesn't just happen in 8 weeks or 16 weeks either. It's really about starting to change the structure, the environment, and the access that is available for these individuals long term. And so there are ongoing resources that are also part of this Transplant Wellness Program that all participants will have access to. So additional group exercise classes in the community or online, wellness webinars to continue to educate them around the components, and especially as we start to introduce other components that you'll see at the end, the timeline of what's going to be built. And then gathering them together for group wellness behavior change, kind of health coaching based sessions. So these will start to be added in for the individuals, again, to really help them talk through their barriers, the things that come up for them over their transplant journey that might take them away from engaging in more movement or physical activity, and really to start to share that common experience and build that support. The participants are all adults listed actively or temporarily inactive on the transplant list, and we are starting with the kidney and liver populations and then building out to the lung transplant population. All participants have to be able to provide written informed consent and understand the study information in English, as well as for completing the questionnaires. They have to be approved to exercise from the CEP and/or have medical approval from the referring physician. And for those that are doing the work online and completing tools, assessments online, they will need access to the internet connected device. Exclusion would be any of those that the clinical team does not clear for exercise, if they're unable to provide that informed consent, if they have a clinical condition, even once they've been referred and the CEP screens them out due to an issue, and if they don't have that ability to do it either in person or safely from home. So as a hybrid effectiveness implementation study, we're looking at the effectiveness of the exercise intervention, but also looking at the effectiveness of implementation. So there's kind of 2 layers of assessment pieces here. At the effectiveness side, does the exercise intervention work? We have a series of patient-reported outcomes as well as functional fitness measures. So you can see here we're measuring physical activity levels, quality of life, nutrition, as that will start to be built in, and it's a critical component of wellness, sleep, as another component of wellness, and then emotional well-being with that anxiety and depression that you can see here. The fitness assessments that we capture are really functional fitness assessments. We're doing this not bringing them into a lab, but really real world settings. So if they're in a community-based program, if they're doing it from home, a number of functional fitness measures that are completed either over Zoom or in person, depending on the population. And I should have mentioned the PROs all completed through REDCap, so online as well. With the option to do it on an iPad in person if they need that additional support. So you can see here the functional fitness measures, and again, things that we can do safely and effectively, and we have been doing it for over 2 years in other populations, online as well as in person. The second component of the levels of assessment is really at that implementation side. So we've got a number of frameworks that we're using to build out the implementation and understand the processes and the strategies for what is going to work. And I will just say, with the clinical team, with Dr. Mustada, Barak, and Deb, we've got that ability really to have that clinical support for implementation of this in the care pathway, which is absolutely critical. We're evaluating it using the REAIM evaluation framework, which assesses the reach. So are we getting the referrals coming in, and are those referrals consenting to come into the program? The effectiveness, so the intervention itself, and so that's the functional and the PRO measures more so. And then at the program implementation side, the adoption, the implementation, and the maintenance. So everything from training time for our fitness professionals, and we'll have more than one CEP eventually helping to deliver the program, to the resources that the participants get, to the uptake in the care pathway and the availability of this at different times pre-transplant, but for some people potentially after transplant if they have a short pre-transplant period. In addition, beyond the PROs, the fitness measures, and those implementation markers, we are collecting both qualitative data and then healthcare utilization data. So the qualitative is both surveys and with open content areas and semi-structured interviews to really get into more in-depth understanding by conducting those semi-structured interviews with both our patient population, eventually moving beyond that though to also family members, support persons, and our healthcare providers. So those key factors for implementation, satisfaction of the program, and the value of it really at a deeper level than understanding the impact of the actual interventions is going to be critical for ultimately building a clinical program that is what the population can feasibly do and wants. And then finally, the healthcare utilization. So looking at things like length of stay, like medication use, and then other markers of cost and effectiveness. So a number of pieces that will be pulled from the healthcare data sets and used in conjunction with some of the other implementation markers to really understand the feasibility and sustainability of the Transplant Wellness Program. So with that, I'm going to hand it back over to Maneka to finish up the last few points here.
Thank you, Nicole. Nicole explained the Transplant Wellness Program in detail. Now, I just wanted to kind of tell you about our timeline, because we're just starting to recruit patients into the Transplant Wellness for kidney and liver transplant patients. It just like right now, we just started the recruitment, and we are working towards developing the Transplant Wellness Program for the lung transplant population. They have very specific needs for the exercise intervention. So we're working with that team to develop the protocol, and we're hoping to get that program roll out in the spring. And we'll continue to develop additional wellness resources. And really, our end goal is to develop a comprehensive wellness program for all the transplant patients in Southern Alberta. And we're using a stepwise approach to build this program. So right now, as Dr. Culos-Reed explained, we're just starting with exercise and wellness behavior change. And we are going to build it in layers. So we'll address the other components of wellness, such as nutrition, mental health, sleep. And not only that, we would like to develop a wellness program for our caregivers and also the donors. So that is our future direction, so to say. So with that, I will go on to the next slide. I want to acknowledge our partnership. So we have partnered with Caregivers Alberta to provide resources for our Transplant Wellness Program participants, caregivers, and also with the Kidney Foundation of Canada. And there are a few others that I'd like to acknowledge. Most specifically, I would really like to acknowledge our donor, Mr. Jim Gray and his family. Without him, this program would not be possible. So we are very grateful for his support. And our patient partners, there are various people at the University of Calgary, including the O'Brien Institute of Public Health and the Thrive Center, who have helped us develop this program, and also so many people at the Alberta Health Services, so many clinicians, nurses, social workers who have helped us develop this program, and would like to acknowledge the University of Calgary as well. So with that, I will end this presentation and open the floor for questions or feedback. Thank you very much for this opportunity again.
Excellent. Thanks, team. Great presentation. I will open it up to questions. Anyone, just feel free to unmute and
Hello.
Chantal, go ahead.
Hi, thank you so much for this very inspiring project and presentation. I'm Chantal Bimer. I'm working in Montreal, Quebec. I'm a researcher, but also a dietitian. So I'm clearly interested in knowing what you are planning for the nutrition side. I saw that you are going on a step approach. So what are the main goals of the nutrition aspects when you will address this wellness component?
Maneka, did you want to take that, or?
Sure. So Chantal, right now, since we're at the very initial stages, we are focusing on the exercise and wellness behavior change component, but we are hoping to bring a nutrition expert on board and perhaps provide like nutrition support for our patients as the next level, and also to collect data on so that we can see how addressing the nutrition component in wellness improves the quality of life for our transplant population. But it is really, it's something that is in the works, I would say. But right now, because we're just rolling out the exercise and wellness behavior change piece, we are just incrementally building this program.
It's already in our clinical care pathways as far as the different organ groups. I know in liver, sarcopenia, is such a big problem for our patients while they're awaiting transplantation, and so all of our patients pre-transplant see dietitian as part of that. We would like to just incorporate it more holistically into the program as that second step and that stepwise approach that we've given before. But the other issue is, post-transplant, as many of you here will know, that we see the opposite problems, and with the transplant medications that we use, we have very high rates of obesity and diabetes, and cardiovascular comorbidity is something that we share across all the organ groups following transplantation. So I think it's in the pre and in the post, there's this is going to be an important part of it, and exercise and nutrition just seem to be very, fundamentally linked. So yeah. Thanks for your question, Chantal.
Yes.
Dimitri.
Thanks for that excellent presentation and multimodality rehab program that you guys have established. A couple of questions. I actually work at UHN with the lung transplant program, but do see a number of renal transplant for frailty assessments. And the recent hub meeting that we had with our exercise hub, one of the key things that have emerged is the mental health aspect. And with the multimodality program, I realize it's group training, there's the psychosocial support there, but how do you guys get at the mental health aspect with your program? And have you given that some thought on getting a psychologist on board, et cetera?
Yeah, thanks, Dimitri. Yeah, and I appreciate you bringing that up because most people think of exercise and the physical functional outcomes. And so we do a lot of work within Exercise and Educate to highlight for our participants some of the mental and emotional well-being changes that they might start to notice or that they might work towards and have a goal. So we provide them with, very kind of lay summary of the evidence for the role of physical activity in mental health, which is substantial. And it's, somewhat astounding that we still don't see exercise and physical activity worked into more of the mental health pathways in general. And so we will work on that. We've got the measures. We'll be able to see if we're impacting the anxiety and depression in particular. And then we've got the educational pieces and the training of our clinical exercise physiologists really in that Exercise and Educate model so that they're building awareness and highlighting those benefits. From an exercise prescription perspective, there's strong evidence for multimodal. There's some evidence that some strength training can increase anxiety. So it really depends though on your actual prescription. And so we'll just, be able to monitor that carefully and see what people need in terms of different outcomes. But there isn't, as far as I know, from that mental health perspective, really strict prescription of, this level. We know with increasing dose and for a longer duration of time, you tend to get stronger. So there's a dose response there. But there's not one prescription that is kind of the best means for enhancing mental well-being.
Just to follow up on that, thanks. So is there a psychologist available? Let's say a participant or a lung transplant candidate, renal transplant candidate wasn't doing well or post, do you guys work closely with psychologists, mental health? Because that has been a strain that we heard across the country, and I was wondering how to address that.
Yeah, I can, again, from the clinical side, we have social workers embedded that do a lot of counseling as well. But it's an under-resourced area. We share social work between our lung and liver program, and there's separate on for the different organ groups. But it is something, and it's something that we also heard from our patient advisors that we need to build this, right? And it's especially in that early post-transplant period, and everything that you're dealing with our patients deal with the recovery and issues of survivor guilt and other things. We would really, really like to build additional resources in group or individual for patients as well to support them both going into transplant and then in the recovery period post. So yeah, I think that will be a very key recruitment, we hope, in the next phase of the program.
No, thank you.
Yeah, Dimitri, just to add on to that stepwise approach, we have that mental health, and the team has already started discussions around what could the referral pathways be. But as Dr. Brack just highlighted, that sometimes is an issue, is actually having access. So we've put together kind of resource packages around health and wellness in general, and the mental health resources that are just available in community-based settings. But having that direct link in the program based on need would be ideal.
For sure, because we've heard that throughout the Exercise Hub, a rehabilitation meeting we held in collaboration with CDTRP in February, putting a meeting report together, was one of the common themes echoed, that patient partners want to see more mental health supports embedded into these multidisciplinary programs. And it's not an easy undertaking by any means across centers. So it's something to think about.
Yeah, and we do have the help coaching based support that's built right into the exercise and educate model. And so I think that component to a greater degree than just exercise alone will start to address some of those other issues for individuals too. And the facilitators will have that training in the health coaching.
There was a question in the chat that I'll ask Nicole. Just again, you mentioned it briefly in the presentation about the distinction between kinesiology and a CAP, and that's different, I guess, in different parts of the country, right?
Yeah, the terms are often used interchangeably. So kinesiologist and a clinical exercise physiologist both have that degree in kinesiology. The CEP designation is through the Canadian Society for Exercise Physiology. And so it's an additional exam and hours working with specific populations to have that designation. In some provinces, including Ontario, the kinesiology professional designation is there. It's not there across all other provinces, though. But you can think of them interchangeably for sure, and it just is a provincial difference in certification process.
Yeah, thank you very much.
Sean has asked the question here as well about enrollment pre versus post-transplant, and our intention was to enroll as many people as possible into the rehabilitation, but pre-transplant, but recognizing that some patients may be too sick, there might be short waiting times. We also have the option to enroll patients when they come back. In our case, all of our solid organs except for kidney are done in Edmonton, so our patients tend to spend about 3 months, depending on the organ group. For liver, about 2 months in Edmonton, and come back to us about the 3 mark post-transplant, and there will be an opportunity to enroll some patients there as well. So did you want to expand on the difference and how the exercise might look slightly different post-transplant versus pre? Or
I was always also just going to say in my question, thanks, Kelly, that everybody starts at a different point, and I appreciated that your first 2 sessions were going to be very much about the individualized approach. As a transplant recipient myself, I remember going to a wellness program that was really just for everybody, and I arrived. I was 28 years old, and it turned out to be chair yoga, which was fantastic for 80% of the people there. And I was looking for people to go hiking with, and so like there is something to that individualized approach, and making sure that everybody can benefit from not just exercise, but nutrition and mental health and the other aspects of your program too. Fantastic work.
Yeah, thanks, Sean. And you're absolutely right. I mean, we do have 2 cohorts, so people can be in the exercise intervention pre, and then, as Kelly just said, post. We'd be looking obviously for very different outcomes and really why we're using exercise for both of those groups to prepare for surgery, to help facilitate recovery and build more wellness after. And you're right, it has to be tailored. I mean, we could just give Canadian guidelines for physical activity and nutrition if we wanted a general approach and save a lot of money, but probably not have much impact, right? And so that individualized nature and that individualized prescription is absolutely what's going to allow us to build impact and still be able to bring people together in a group, right? You can imagine coming into a class and not chair yoga, but just we've got different pieces of equipment or different things you can use online, and you can do your own thing while somebody else is doing their own thing, and then still connect together.
Yeah, that's fantastic. I love the idea of a prescription. Is it like a formalized conversation? Like Kelly, you mentioned the clinical pathway, that this program is embedded in there. Like, is it actually a prescription conversation that happens with each patient? Because I saw a program that Parks Canada started where you can actually start to prescribe a Parks Pass for your patients. I think there's only 100 in the first year's pilot program, but there is something motivating about that tangible conversation and having a piece of paper. You don't take it to a pharmacy or anything, but it's just to say, no, this is what we agreed to. This is what we're going to try and work on.
Yeah, it is going to be individualized. Yeah, go ahead, Nicole.
Well, I was going to say, yeah, you've hit on 2 points there, Sean. The referral from the physician to the program is a piece of paper. Like, we want you as part of this clinical pathway to really follow up, and then we'll actually reach out to them. So it is going to be embedded in their clinical care pathway. And then they do meet one-on-one with the CP, have the assessments and the screening, and they will receive their individualized, tailored exercise prescription.
Awesome. Fantastic.
There's another question in here from Erica. Did you want to ask it, or do you want me to?
Yeah, sure. I'd like to ask it.
Sure.
I was wondering, if you're another researcher team that wants to copy your model, what are some of the big challenges you face setting up this program?
Yeah. Thanks, Erica, for the question. Very good question. So setting up the program, I think getting the buy-in from the different stakeholders was probably the most challenging piece so far. But I will probably have more challenges for you if you speak to me like 6 months from now, because we're just starting recruitment. So I think, look, when you look at enrolling patients and getting the consent to contacts and so on, the referrals per se, into our program, and then having patients complete the various surveys that we'll be distributing at various time points. Those will be the future challenges. But I think, we've had an incredible amount of support, so we've been very lucky. So we've been able to collaborate with all our stakeholders and get their feedback on various aspects of the study to develop this study. So including clinicians, patients, and researchers. So right now, I guess developing, like, it's like a regular research study. It takes time and effort. But we're very happy and excited to get started now. Nicole, I'm not sure whether you want to add anything, or Kelly, to this.
Yes, it's been a process.
Yeah.
Like Stefan, had this idea, and along with Deb, and the generous support from the donor family, Jim Gray, and that incredible donation that made this work possible. And and Nicole has worked in this area, in oncology predominantly, but it was over a year ago, we started to come together. Maneka, when did we hire you? In January,
last December. Yeah.
December. Yeah. So, it's almost been a year, right? And weekly meetings and getting a lot of feedback, and then, developing something from this multidisciplinary lens, everybody bringing something a little bit different to the development of the protocol and the plan, and then really getting, as Maneka said, the input from our patient stakeholders was so very valuable. Not only about the program in general, but what they would like to see it become, and our worries about survey burnout and things, because we have a lot of things built into what we're hoping to evaluate. Now the rubber meets the road, and we're going to start enrolling patients, and we'll get that feedback and see how it goes. So stay tuned. But yeah, it's taken some time to get to the the point where we hope to very soon have our first patient enrolled and our first patients involved in classes. But yeah, I think investing all that time and effort is going to be real important for the success of the program going forward.
Thank you.
Chantal, you have a follow-up question?
Yeah, just a quick question. How many patients do you expect to enroll in the program? Have you thought? I imagine as much as possible, but
Maneka, you want to take that?
Yes, for sure. So Chantal, we are hoping to enroll about 350 patients, and that is after a loss to attrition and everything. When we've done the I guess the power calculation for our intake. Yeah, about 350 patients from kidney and liver, and these patients will be each patient will be followed for a period of 5 years. So they're getting the exercise intervention, and then they will they will be offered for the maintenance resources and exercise classes after that initial exercise intervention.
Thank you.
Well, it was a robust discussion. Thank you, everybody, for your questions. If there are any final questions or thoughts, if not, please feel free to reach out to myself or Nicole or Maneka, Stefan, Deb, any of us that are very fortunate to be involved with this program. And Anita, you're muted.
So sorry. Thank you for this presentation. It was very interesting. Just to introduce myself, because I'm new to this network, I'm a postdoc researcher at the MUHC, and I'm working on a project that's working with patients who experience graft loss following a kidney transplant. And our ultimate goal is to kind of develop some kind of multidisciplinary set of supports or resources for patients who are going through this particular experience. And so this kind of program is very interesting to me. Now, the previous question was about, what can other programs learn from you and how you're going about developing this program and evaluating the program. But I'm curious about whether your ideas, whether they were inspired by other similar programs for transplant patients, either in Canada or elsewhere, or if you were largely, I think I understood that both of you are coming from oncology, or did you kind of take more models from oncology as you were thinking about this?
Yeah, great question, Anita. And it's really a bit of both. So we did do an extensive look at current evidence, the prehabilitation work across different populations and where possible work that's been done. Kelly brought in the knowledge from the liver group, Stefan with the kidney group, and we'd had some pilot data here already with the kidney and exercise specifically. So it really is being built upon what we know and have seen has worked in those populations. And then the 12-week model and the behavior change piece has really been built off the work that I've done in other chronic disease management in oncology and also in mental health work with my background in health and exercise psychology. So it's a combination of those two pieces, but all of it evidence-based, clinical and or published research.
Yeah, from the liver perspective, I've been fortunate to collaborate with Dr. Puneeta Tandon on several projects, related to sarcopenia in our pre-transplant population and the impact of that and potential, interventions. And we are continuing to collaborate with Puneeta. She's got a multi-center trial looking at exercise intervention for liver patients in 6 centers across Canada, randomizing patients to exercise intervention or standard of care 2-to-1. So we will support that trial in our liver population as much as we can. And if patients are, randomized into that, then they still have the option to receive post-transplant, the Transplant Wellness Program through that. So yeah, this really is quite a unique program as far as this type of intervention in Canada or elsewhere in the world that I'm aware of. So quite excited to see how it goes and what it grows into. Okay, well, it's about time for me to go to clinic. So I think we'll wrap things up. And again, on behalf of the CDTRP, I want to thank our two presenters today. I want to thank you for having me as the moderator. And if there are any additional questions or comments, suggested topics or speakers, please feel free to reach out to Erica. And all participants will receive an email. Feedback's very important. We'd love to hear your feedback. It only takes about 3 minutes to complete this survey, I'm told. So please do that. And again, thanks everybody. Enjoy the rest of the day and happy Halloween.
Thank you very much. Bye.